All right, today we're going to look at the body cavities, how they're labeled, where they're at, and what we would find in those. In addition to talking about the body cavities, we're going to talk about the names of the membranes that line those and the different spaces within. This is a continuation on to our kind of our big introduction of gross anatomy and a lot of that anatomical terminology that's just so crucial to get right and to get familiar with early in your anatomy and physiology experience, because these are all terms that are going to keep coming back again and again and again, and it's going to be concepts that keep building off of those. And so definitely want to spend extra time here early on as we're learning anatomy and how to set yourself up for the future. So first of all, your body has cavities in it. Okay, and I'm not talking about like, ooh, there's a cavity in your arm or things like that, but we have some cavities along our torso and in our head that house a lot of our major organ systems. First up, we have, in general, two big categories. We have a dorsal body cavity and a ventral body cavity. Dorsal meaning back, ventral meaning front. All right, in our dorsal body cavity, you're going to find your cranial cavity, which is the inside of your skull, and then your vertebral cavity, which is the space that your spinal cord occupies. Okay, so your backbone is not a solid structure, it's a lot of small bones, and then there's a cavity that your spinal cord goes through all your vertebrae there. So cranial is your where your brain's at, vertebral cavity is where your spinal cord sits. In your ventral cavity, we have a few. We have your thoracic cavity. That's your chest, and so that's where your heart and lungs are going to be located. That is going to be separated from your abdominal cavity by your the muscle that sits there, which is going to be called the diaphragm. So thoracic's up top, abdominal cavity is the one below, and then we have a pelvic cavity that's down there toward the bottom. And sometimes you'll see those two called or combined together in their name as an abdominal pelvic. There's not a membrane that separates them. It's kind of your hip cradle is the rough delineation between the two, but you'll see all those terms used in that way. I'd mentioned that these cavities, or maybe I'd mentioned that one of the cavities was separated by a membrane, and that membrane, or actually muscle, would be the diaphragm. However, we have a variety of different layers and membranes inside of these cavities or surrounding them. Once again, just a helpful directional term as we look at where things are located at, and it's tough on your these cavities in your body are kind of unique in the challenge of maintaining a proper equilibrium inside there. It's not just, when you open up your chest cavity, it's not full of blood. It's full of your organs and delivering the right nutrients back and forth. We don't talk about them a ton, except for in your cranial cavity with your brain. There's going to be some special things that we're able to use to maintain equilibrium in there. But some of these membranes that help us perform a variety of functions can be found here. First of all, a couple terms. The parietal side of the membranes means the membrane that's attached to the wall of the cavity. So on your chest cavity, this is what's actually attached to the outside wall of your cavity. And then the visceral membrane, those are the membranes that are attached to your ribs. Not ribs. And then your visceral membrane, that's the membrane that's going to be attached to the actual organs themselves. All right, when we're doing dissections, we're going to be able to see that, hey, there's a lot of these layers of, it's not skin, but it's a skin-like tissue, and then these membranes that form these. Your pleural membranes can be found in your thoracic cavity. Those are really specialized in that they need to maintain suction so that when we expand our chest cavity, our lungs stick to it and fill up with air, and vice versa. Sometimes it doesn't always happen, and we get what's called a collapsed lung, in that our lungs have come unstuck from those pleural membranes. We have pericardial membranes. That's going to be in pericardial. We hear the word cardial in there, and so those are the membranes that are around the heart, and they're going to have some specialized fluid to help with lubrication and nourishing the heart muscles. And then we have the peritoneal membranes, and those are membranes that are going to be found in the abdominal pelvic cavity.